Screen as well. I need screen because something must be done from screen. Okay. So we have some perfect presentation. I check it as you see. So let's do. I will ask Sopo to upload this lecture, not only lectures but presentation for you especially. So we spoke about the communication and how important it is communicate with your patient. And the way of communication gave you deeper understanding of problem and a better understanding of the way of treatment of your patient. Yeah, of course. And we go through the history, how it begins in the first centuries, how a patient is nothing for the doctor, only the subject, only the pot we have to find some diseases. Yeah. And so on and so on, how it's changed and what happens then. And we spoke that an intelligent person must know some names from the history to be said that he's educated one. Okay, and to prove his own way of communication. Today we will go slightly more deeper, slightly more deeper, it's over, but okay, deeper. And so we'll speak about the perfect communication, the first communication with your patient. See what is given? Communication between doctor and patient, how to take informed consent. Communicate with colleague. You hear me, my dear? Maybe I spoke only with myself. Guys, can you hear me? Okay, my dear. So I will continue. So communication is important not only between the doctor and patient, physician and a patient, but as well between two doctors or two colleagues as well. What is the main reason why we are speaking here about the communication between the doctors? Because through your education program, through the medical lectures, you study some specific words. Yes, so the specific words is not English; they are in Latin. So these Latin words and Latin language is specific language which make communication between two doctors in over the, not too many, over the world. You get it. This is the first. But another is that the same term, the same word, you have to translate to your patient. So you have to be intelligent. Okay, let's go. What is communication skills, my dear? Communication skills are verbal and non-verbal words, phrases, voice tone, facial expression, gestures, and body language that you use in the interaction between you and other person. Yes, my dear. When your patient come, for sure you have to have poker face. Never and never give your expression, your own mood to come on your face. Why? Because patient come with his own problem and do not want to know about yours. It's first. Then he cannot recognize that it's your own. He thinks that you think about him or her, doesn't matter. So he can be scared about it. Yes, if you are angry, something happened in your, I do not know, in family, maybe in street, some accident, and you are very angry. And if your expression is so angry, you will meet your patient. Can you imagine what will happen with your patient? Yeah. Can your patient follow you? No, no way. So about the expression, you understand about the facial expression as a part of it. What about the non-verbal? Non-verbal, it means body language. Okay, some of this body language expression, from the childhood, and everywhere, everyone gets the same. Like bye-bye, or hi, or Excellent, yeah, but not in every country. If you will say this, I do not remember perfectly. I think in the Mexico it means something not very good. So you have to know about the country, about the ground from which comes your patient, to not to do some mistakes. So better to take less body language, but something which is very common, like open eyes or something like this, which shows that you are in conversation, must be done. Another what is always true from body language, when you speak with your patient, always, if you want to prove yourself, to make sure your patient shows the palm of your hand. It's non-verbal kind of language which shows you that you have nothing covered. Everything is clear. Comes from inner side out to your patient. Understand? It's maybe someone will think that it's not important, but it works 100% for sure. Now, by comparing, can you imagine that someone of doctor which say, "Okay, my darling, you will get this medicine with dorsal part, yes," and another doctor, "I will give you one advice. This medicine is for you." Which one you will prefer? Of course, who open his heart, who shows the palm of your hands. Yes, for sure, it's one of the way how to communicate with patient, how to take the soul of your patient, and it's important. If your patient trusts you, if your patient follow you, it's placebo 25% of treatment without any kind of medication. Okay, it's some medication, it will be 30-40. It's some procedure, some laboratory, and some other kind of maybe surgery, and 100% your patient will be treated. Understand? Get it? And another one is, if your patient like you, is with you, he will follow you and give advice to other people to come to you. Understand? It's very important as well. Let's see what else is given. So, voice tone, tone of your voice. If you speak very slowly, something for your own, will it be good? No. If you raise your voice like me on my lectures, I think it's not good for communication when your patient is near you. So you have to speak calm voice, for sure. It must be calm, yeah. With normal tone, with no changing in tone in the beginning. Then as I will say, we will discuss why in the beginning and how to change the tone. But it's very important to follow these rules. Okay, verbal. The word which you use always is kind of treatment. How? If I will say to a patient, what to do with you? It's so difficult. I do not know, will it help you or not? How do you think? Will it be treated? But for sure, I am right. It's a very difficult situation. We do not have specific medication. We do not know how to treat this patient. But can I say this way to patient? No way. How I have to say? Oh, I think let's try. It's very good, something new. Let's see. Yes, your situation is different from others, and I think we will use some different from other kind of treatment, and we will get some benefit here. Understand? Difference between these two kind of communication. Okay, so verb which you throw out is medication for your patient. So be careful about it, okay? You can kill your patient or treat it. Doctors and other healthcare professionals all grew up with a set of communication skills we obtained and learned from our environment. We consider that as part of our personality. That is what I am, this is where I come from, this is me, this is my way. No way. These phrases are wrong. Wrong in the beginning. You have not achieved a medical student position because of your effort to continuously learning and training yourself new technique. So, why you stop at communication skill? Communication skills are learnable, trainable, adaptable, just like any other skills. Is here something difficult? I think no. So, yes, we have our own culture, which comes from our background, but we have to change it. We have to change it if we want to be perfect specialists, perfect doctors. We have to study how. Let's see. Rationale for communication skills learning. Communication is a core component of clinical competence, medical history taking, physical examination, clinical decision making, communication skills. From this one, my dear, physical examination, we begin with anatomy as well when we spoke about the clinical orientation anatomy. You remember we have this kind of history taking, not for you, but some of you are in PBL groups as well, are given in the PBLs. Clinical decision as well, we gave you when we gave on exams cases. Yeah, for sure. So, from the first communication with our university, you begin to treat, you begin to prepare to be doctors and increase your communication skills as well. Effective communication improves patient satisfaction, recall, understanding, adherence, and the outcome of care. Communication skills turns theory into practice. Even experienced doctors should continually enhance their knowledge and communication skills. Effective communication can make history taking and problem solving more effective. Which one? 5 communication skills. Verbal, we spoke about it. So every word is medication for your patient. Maybe tablet. Non-verbal communication, which means that your body language. So as well, what is difference? Are here some Indians with me on lecture? I cannot see you. So from the first meeting with Indian culture, I have some problem because in Georgia to sit crossing the head is impolite with elder. But for Indians, from their culture, perfectly, it's the highest position of politesse. It means that I will do nothing more, only listening you. See how difference can be your body language. So when I see that he is sitting with crossing hand, I think, what's happened? Why is he sitting like this with me? But then I understand because I want to be. I am not for sure 100%. I want to be intelligent, and I try to hear, try to study other people. Understand? So that's what you have to do. If you will sit boring, your patient will never say the perfect disease why he is here. If you are interested in your patient will answer you. Understand? This is differences, okay? So let's go. Verbal, non-verbal, voice management, as I say, listening, active listening. What is active listening? Who knows, my dear? I think you know. Listening is I can sit and scrolling something, but I hear you, yeah, for sure. Is it active? No, it's passive. And look at me if I'm active listening. So on my face, some expressions that, I understand. Oh no, it cannot be like this. So I follow the speech my patient give me. Understand? It means active listening. So my patient thinks that I am all in his problem. Cultural awareness. No, it's nothing new. Here you understand what it means. If not, we will speak it slightly later. So verbal, what is given in your presentation? Let's see. Questions, clarifying, paraphrasing, summarizing. So it's very important summarizing here, my dear, because your patient can be talkative and speak a lot. So you have to take some very perfect ideas, not all his speech. Non-verbal, environmental, closing. Oh, we'll speak about closing right now. And accessories, eye contact, proximity orientation, touch, posture, facial expression, movement. Voice management, it means intonation, word stress, pitch, loudness of voice, pitch, pausing, active listening, verbal and non-verbal sign as following your communication speech. So when we speak about the verbal, here is given the first person, question, clarifying, paraphrasing, summarizing. Let's see. What kind of question can be given to your patient? Your patient can be talkative or non-talkative, very quiet, kind of. So you have to give some specific questions. Sometimes in the beginning, it will be useful to take closed question. The question which needs answer or only yes or no. Okay, it's named yes, no, or one word answer. To your patient, if your patient is shy enough, it's easy to nod the head, say no or yes, and slightly, step by step, change the and open toward you. Okay. Then after the close question, we have open question. Open question needs more than one word to answer. Like why you think. So the first, do you have fever? It's closed. Yeah. Question. Yes, I have. No, I have not. Or yes or no. Open question. When it begin? Can you answer in one word? No way. So you need more than one word. Why it begins, how it begins, what happens then, and this kind of. Leading questions. Phrase to elicit a particular answer. So it's specific ways that I change the way of speech and give direction to my patient to answer. Understand? Like maybe my patient will begin with speech that he has itching everywhere, yeah? So my directive or leading will be, how do you think, is it connected with the meal? What you get 24 hours before itching? Understand? So now I change the way because why? Because allergical reaction, and I think it's allergical reaction, can begin from some nutritions. Don't forget about it, okay? So this is leading question. So which kind of question we have? Closed, open, leading. Okay, let's follow presentation. Your appearance increases confidence, maintain a professional appearance, clean, neat, conservative, see dress code, or now speak about the dress code, my dear. Physician in almost over the world, physicians and doctors, wear white coats. Why? How do you think? Who knows why white? Not black, not red. Now it's a differentiation. So in blood banks, our girls wear rose color. In surgery, it's green, as I remember. Yeah. So, but mainly it's white. Why? Maybe it's more comfortable to eyes as well, why not? But the other idea is that white is so fast became dirty. Yeah, agree with me? Once you take your hand on somewhere and it becomes dirty, can you wear it on another day? No way. Yeah. So what it happened? Everyone knows about it. Everyone get it. So when you wear white color code, your patient which come and say, "Oh, white," he gets that your doctor is clean. What it means, please? Clean, it's protective. If your doctor is protected, if he protect himself and never use dirty, because on the black you cannot see that some dirty spots, yeah. So I can trust my doctor. If he protect himself, so I think he will protect me as well. Yeah. He is clean, so no infection is with him. Oh, okay, I will trust him, and so on and so on. It's the first one. Another one, white. Maybe you see this a lot of movies about them. Christians, not Orthodox but Catholic kind of. They have black coats, but inside is white collar. Yeah. Remember, like everything and only white line here. It's not by chance, it has specificity that shows that inner side is clear. Understand? So not only surface is clear, but your thoughts, your ideas, your I don't know what your treatment is clear, white, light as well. Okay, light as well, because not dark, not heavy kind of like red, dark blue or brown maybe, but light, white color as well. Understand, get it here? How deep idea is only in color. I do not say about the style. Then style, my dear, why coat? What not beautiful dresses with some, like means with something, but I'm on lecture now, not in the hospital. In hospital, I have specific suit, I will show you. So, why, my dear? Because we have very different patients from different culture. Not to make them ashamed or something. We will cover everything under the coat. Okay? It's some barrier between us. So I show them that I'm so polite to them that I try to protect their thoughts and their lifestyle. Understand? Get it? So this is another side of the specific suit dress code that the doctors have to use. Okay. Next one, my dear, why surgeons has a green color suits? Do you know? Not white, but green. Can you imagine? No one knows. Only me. In surgery, my dear, when you cut, blood is coming, yeah? Sure. So when you are very long period in surgery, doing some operation more than 1 hour, your eyes are so tired that cannot recognize the color. So white and red is not antagonist. So you can make some mistake. But green and red is not the same. They are antagonists to each other, these two colors. Understand? So they use green to somehow to protect their eyes from this surgery operation place, from the blood and so on and so on. Okay, my God, how time is scrolling. So dress code and syllabus goal is to inspire confidence. Okay, now let's speak about the comfortable, your patient and confidence. So, next step, when your patient came to your room, okay, your patient sees that you have this dress code, white suit, or which it will be useful to your hospital. If your surgery, it can be green as my wall here, and so on and so on. Does not matter, but he sees that you have specific dress code. He calms down that you are specialist, that you are clean, that you are protected. You will protect him, but it's not enough. It's not enough. Why? Because you know your profession, but your doctor not, or your patient not. He come first time maybe to you, and so he do not know what to do with you. He is scared, and if he is scared, he can be or shy, or aggressive, or bored, or something, but not or talkative as well. It comes from shy kind of as well. What you have to do, how to protect your patient? You have to comfort your patient. Never say, calm down, sit and calm. No, it will not work. You have to do something very strange, my dear. You have to work like his relative, maybe his mother. No, never. And guys perfectly cannot be mother by the idea. I say about the position, how to work. So he must think that you are like his mother. What you have to do, you see your patient is maybe aggressive. Aggressive. I come here, I wait so long, what's happening in your hospital, and so on and so on. Happens sometimes. So I think you know about this kind of. What you have to do? First, make confidence your meeting. What you have to do? Do not be lazy, do it by yourself. Stand up, close the door, or check if it is closed perfectly. Why? Only because in your patient mind is that you close the door, so you will speak confidence and no one will get information. Only doctor. Understand? This is the first step. Then, and it is time when your patient calm himself down. Then you see that he is, how it is, boiled inside. Ask him, can I help you? Isn't it hot here? I can open window for you. Do not forget to say for you, not for me. Oh, it's hot, I will open. No, it's hot here for you. Can I open it? Okay, so your patient will say, oh, from the first step, my doctor think about me, about my comfort. Okay, why not? Let's trust him or her. If not about the window, you can do another kind of. You can give glass of water. Here is very clear, white, cool water. Don't you need it? Please drink it. Why not? Yeah. So he will think, oh, protect, make me comfort. Let's see what will happen. And he will calm down. Understand? So this is the way, one of the way. Make your patient comfortable. Make sure the patient is comfortable. Sit at the patient level. So what about the levels? Here's two ways, my dear, European and American. Okay, let's take both of them. European face to face on the same plane, but our table can be between us, and it's more comfortable by my idea because yes, your patient thinks that you are on the same stage, on the same plane, but as well, it's some border between you. Okay, so it's not familiar. Another way is sitting 19-degree. Sit near your patient, like me now to computer, and speak with you this way. So it means that no border is between us. I sit near you like your friend, understand? Not physician. Sometimes it works. It's American style. 90-degree American style, face to face, with border with desk between the patient is more European. But in both countries we use both of them. It's only by the origin where they come from. Okay. Be aware of the patient's personal space can vary among cultures. That's why I say that we like to take some desk between, because in some cultures it's impolite to sit very close. Two children, yes, two women as well, and vice versa. If doctor is women and patient is man, it's impolite to sit very close sometimes. Yeah, in some cultures. So better to sit opposite, take some border like desk maybe, notebook, some book maybe, which makes some space boarding between you and patient. Okay. Continue to consider the patient's comfort during the history and physician. Question technique. The cone technique moves from open to close question. It ensures that the doctor obtain a picture of the problem from the patient perspective by opening up the discussion. With the need to confirm specific and narrow down the cause of symptoms, the doctor then follows with more closed questions. Okay, and vice versa. In Georgia, we begin with a closed question and then go to the opens, but in any cases, I will give you advice which is not given here. When your patient sit and you protect him and to make comfort, you begin your conversation. So the first is why you come here, yeah? Some kind of, which is the main symptom. So what's happened? What's happened with you? Now give your patient not more than 3 minutes, but be silent and listen, but do not get this information. For 100%, in these 3 minutes, he will say a lot of lies, a lot of piece of lies, for sure. Why? Because he want to make his personality important to you. So if he had headache, he will say, "Oh my God, no one has this kind of pain," and so on and so on. Understand? So never trust patient from the beginning, but give this patient this 3 minutes to take everything that he have inside. It makes him more comfortable to speak with you. Okay? And only after, take your patient in narrow way and make him follow the way you need to make the diagnosis. Let's see what is given here. Communication process of a medical interview. Initiating the decision, gathering information, providing structure, building relationship, explanation and planning, closing the lesson. In real medical practice, dealing with a difficult patient are seen almost daily. Difficult patients are ordinary people who come to your health institute, whatever is that, because they have to, not because they want to. Get this difference? They have to, not want to. Sometimes they have even been brought in unwillingly by a family member or a friend. They come in with the vast range of different personalities, cultural background, and current emotional state. The silent patient, which kind of patient can be? Patient can be silent. What it means? Silent can be two types. Silent, it means that he cannot speak. Maybe he has no articulation of the tongue. Yeah? Or he is deaf. And silent is when he is shy enough, or by his religion or other kind of cultural differences, he cannot speak with you. Okay? You have to make this differentiation as well. Silent. Talkative patient. Talkative patient is opposite side, when patients like me speak a lot about everything, everywhere, and so on. So, not on the lecture, please. So you have to stop him, but very politely, okay? Vague patient, angry patient, depressed patient, Daniel patient, anxious patient, somatization with somatization, dependent patient, long suffering, paranoid patient. Let's see. Here's definition, my dear, about why I do not stop this, because I see that definition is given. Let's read and then check what is missed in this definition. The vague patient is a patient who has too many symptoms and too little signs. By too many symptoms, we mean to refer to groups of patients who present with diffuse, poorly localized aches or stiffness. Remember also that pain is sometimes described by patient as stiffness. The angry patient, the most important task are the verbally break the cycle of anger and aggression and reduce the threat of harm to everyone. Including the patient here are the 6 steps to improving doctor-patient communication with a universal upset patient protocol. So we have specific protocol and we will start it as well. You look really upset, the first one. You'll typically get one of 2 responses. You bet I am is one of the second, is I am not upset, I am frustrated. Or they may name some other emotional like that. Your observation has caused them to look inside and get clear on what they are really feeling. That's the first thing they have to do. So, great job. Tell me about it. It's the second step, my dear. Tell me about it. So the first you say that, oh, you look really upset, and your patient begin to think, why I'm upset, why I come so angry to you, yeah? The second is that your patient understands that something wrong is done by him, and now he must to tell you about it. Tell me about it. What you have done here is give them a green light to tell you their experience, and your job is to listen, to understand what they are going through, and make sure they notice that you are listening. They feel hard. It is at this point that authentic doctor-patient communication can actually begin. I'm so sorry this is happening to you. This is the third step of communication with angry patient. Let's see. The first, you stop him and make him think about himself. The second one, he explain it to you, and when he explained, he want your idea what's happening, and you say, I'm sorry this is happening with you. Let them know that you have sympathy for their situation. Critically important to maintaining your bond with this patient. The next one is, what would you like me to do? How to help you? How do you think I can help you? Then you have to follow your conversation, which here's what I'd like us to do next. See, my dear, in this sentence is a very interesting word. Here is what I'd like to do. No, what I'd like us to do. Understand what I say? I'd like us to do. So we are a team. We are in one group now, and let's do it together. Okay? Let's do it together. The depressed patient. Now let's say about the depressed patient. Persistent sadness or low mood, disturbed sleep, change in appetite, fatigue feeling or worthlessness, recurrent thought of death. The Daniel patient. When patient creates problems for her medical providers, whether she behaves poorly in the office, refuses to pay for services rendered, files frivolous lawsuits, or does not comply with treatment but blames the doctor when her health does not improve. It means a Daniel patient. Can you imagine? So you do your best. You gave perfect treatment. And I have a lot of patients like this. I describe what must be done. They go home. After 1 month, they come and say, nothing helped. Why, I asked. I forget to drink. I think it's not a good idea to drink this medication. But he blamed me. Understand? He blamed me that it's my fault, that he is not good. No. And I begin, but here's another problem. You have to describe it so clearly to your patient to understand what's happened. Understand? Sometimes it's really our fault. If I will say, understand, so paracetamol 3 times a day, he or follow or will not follow. But if I say, I understand it's pain, so this pain, and we have to decrease pain to improve your mood, when pain will go down, decrease, your mood will increase. So in paracetamol is some painkiller portion, but it will not harm you. So you understand, my patient will follow this kind of treatment. He will understand. Of course, now I spoke very suburb, a lot of words, but you understand the idea. I describe what is benefit if he will take this medication, and what will be wrong if he will not follow it. Okay? Anxious patient. Physical symptoms. For example, you might have a fast heart rate, the sensation of having thumping heart palpitation, feeling sickness, nausea, shaking, tremor, sweating, dry mouth, chest pain, headache, fast breathing. Every of these symptoms can be a symptom of disease. Agree with me? Of course, agree. Heart beating increased when I have some problem and it's tachycardia. Heart beating decreased when maybe I have low blood pressure. Why not? But as well, all the symptoms which I gave you right now, it can be neurotical organization. Neurotic, it means that it's anxious. Something in his brain exists. Anxiety is abnormal if it is out of proportion to the stressful situation. Persist when a stressful situation has gone, or the stress is minor, or the anxious patient doctor should also try to understand why they are anxious. It may be their usual behavior. They may have an anxious personality or be suffering from a chronic anxious state. It may be their response to their illness and to receiving medical care. Most of us feel some degree of anxiety in these circumstances. Fear of dependency, of what might be wrong with us or the future. They may feel anxious about other problems in their life. Communication, be calm and prepared to spend time with the patient. Explains that most patients feel some anxiety and that this is appropriate. So this is given in your presentation. I do not need to read it. So you have to speak with your patient. You have to calm your patient down. You have to explain your patient what's happened with him. Okay? The patient with somatization, emotional distress, or difficult life situation are experienced as physical symptoms. The term somatization refers to the manifestation of multiple somatic complaints. Never see, my dear, the first year educated patient or not patient, person, or when you first went to school, never see vomiting friend. I think everyone hear about it and sees that someone, when he's under the emotional stress, begin to vomit. It's proaction, stress on the soma, on your body. It's somatization. Headache sometimes, unconscious situation, you feel unconscious because you want to avoid the situation, and this kind of, okay? Let's see what else we have here. Okay, today we will speak about the communication, but not perfectly about the history taking. History taking, like communication, I will go through next our meeting. But today we will speak about the way what you have to do. When you communicate with your patient, once again, dress code, verbal, not verbal communication, the first one. Make confidence and comfortable situation to your patient. Differentiate your patient and follow the way of your patient. Aggressive, not aggressive, shy, silent, and so on. For each of these patients, you have a specific way of communication. Then what we have to do? Yes, symptoms of your patient. Check if it is somatization, if it is anxiety, or other kind of. Is it coming from disease or from the patient situation? The third one. And fourth one of the most important. Everything that you do with your patient, must be by the rules, or you will do a lot of mistakes. So first, always, always 100%, and nowadays as well. When your patient come in, not in front of it, not before. When your patient came in, change gloves, take new, clean hands. Why? Everyone knows that it will be new gloves. Everyone knows that you protect yourself and clean hands. No, my dear. And change the mask as well if it is important in some hospitals. And nowadays with Corona we change it. Why? Because when your patients see communication between eye and brain is so bonded that it gave additional point of trust to you. Understand? Only by this. But patient must trust you. Okay? This is the main goal. Okay, so your patient come, you clean your hands, check your dress, if it is clean, mask, make confidence, close the door, open the window, give the glass of water, comfort your patient, give this 5 stage which we speak about if your patient is aggressive, give him the way to understand what's happening inside him, speak about it, make sympathy about this problem, and follow these 5 steps. Then begin question. Then give patient 3 minutes, as I say, to speak about everything that he has inside, but do not think very clearly. Yes, with sympathy, always with sympathy. But be sure here will be a lot of lies. Okay? Okay. Next step is you begin to narrowing his ideas and make history making. So first of all, you have to make data and signature. It's very important, not only for you, for your patient as well. Why? If I will see sitting and listening to you, oh, okay, let's do like this. Why not? But will it help your patient? Something wrong, he will think. If I need some document, will it be done proper way? But if in the beginning you say, okay, let's begin. What's your name? I have to protocol it, type it or write it, or I do not know, take dictaphone or how it is in your hospital, yes, where you will work. Better to do it with computer, or my way is always with a paper and note it on the paper. But okay, nowadays we are eco-friendly, so we do it with computer. Okay, note. Name, surname, I don't know which other questions. So age is very important. Sex, male, female, and so on. Yeah, okay. And data. Why I need data? How it can help me? It will help you to prove your treatment. When you have this protocol, after a period when your patient come to you and give explanations that, oh, you never say that I have to take this kind of treatment, that another doctor, my neighbor's relative gave me this idea. You can open it and find data on this day. See, on this day, it's written here, I give you. Okay? If here will not be data, you cannot prove when you say it to your patient. And it's important not only to patient, but to high position of managers as well. You have to prove what you are doing with your patient. Okay? Because of course, some kind of mistake always can be done. We are simply people, and people can do mistake. It's normal. It's very normal. But when, on which stage it was done, how to change it, how to protect everything, how to roll it, you have to know, okay? And if someone will blame you, you have to prove yourself. Okay, and what about the signature? Signature is some kind of manifestation that it's done, okay? Like how to spot in the end of sentences, full stop. Okay, signature must be done. So this looks simply, very simply, but this is part of communication. This is rule how to do it. Thanks God nowadays we have a questionnaire and it makes our life easier, but we will not follow a questionnaire. We will find out what we have to ask and how to find the way of what we have to ask by our own. And after, when you will practice in it, this questionnaire will be like gift for you, for to make your life easier. Okay, so today I do not want to continue deeper. It's not very deep subject. Here's a lot of to think about, but it has not very difficult for understanding notes or something like this. So what I want for you, from you, excuse me, from you, I want all this kind of patient, aggressive, silent, and other kind of, to be described in your words, and which other kind of can come to you. And now the next point which we have to speak about is when a patient came in, what you will look on. How will you communicate? Oh, one moment, I will open in Google something and you will understand what I want to say. Okay, can you see these pictures here? When your patient comes with this kind of tattoo, maybe, what you will think? Nowadays, tattoo is nothing. It's only the beauty of body, maybe, or some crazy ideas about the life. But in many countries as well, it gave you understanding who is in front of you. Maybe it's a thief, killer, other kind of. In Georgia, perfectly, you can find out this kind of. They have some tattoo on the fingers, how many times he was in prison and so on. But it does not matter. Sometimes you see the person full of tattoo and he looks like very old prisoner, but he is very intelligent as well. So do not look on his surface. Find what he is inside. Happens sometimes that it was my first fault when I was young as you and have the first communication with the patient. I have patient teenager with very red lipstick, black eyes, rose cheek, irokese on the head, some kind of very short skirt, open some t-shirt, very strange kind of. I think she's addict to some drugs or something like this. But what's happened? She plays this role because she was shy. She was very, 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 very shy, and she plays the role this old girl, and how it is in English, I do not know, to make some surface kind of communication to the social where she lives. Understand? So can I ask her about her sexual acts or so on? When I look at this kind of person, I think maybe, maybe, maybe she is not virgin. Maybe she has some sexual interaction and has some diseases. Let's give her this kind of question. But stop till you will understand what she is inside. Okay? Never judge your patient by surface. Okay? This is very important. That's what I want to say as well. So what else? If I forget something, I will continue, of course, next our meeting, but something I miss. So read please, and if you have any kind of question to me, you can type it here or give me next our meeting. From you, I want this differentiation of the type of your patients, how to communicate to each of these patients, dress code from history. Can you give me some explanation next our meeting and we will speak about it in the first minutes. Now, dress, how it changed through the ages and cultures, the dress code. One, I will say you about the Hippocrates period. They have very expensive coat, mainly yellow color. And why? Yellow is gold color, my dear, and expensive because your patient must think that you treat him not for money, but you have your money. You have very expensive coat, so you come because you want to treat patient, to communicate with him. Understand? Very interesting idea as well. So my advice is to check the history of the suit of the doctor, because one period it was dark coats, another period it's only white, one period it was I don't know this here yellow coats as well in the Hippocrates period. In different countries is different kind style of, yes, when you recognize, oh, doctor comes by only surface, by only the dress code of the person. Okay, I think that's all today. Do you need any more explanation, more, do you have any problem? Everything is clear? Oh, presentation. I will ask today, Sopo, what is her surname? I forget, to upload it right today and maybe right now. Okay, my dear. 5 seconds. Not to forget about it. Five seconds. Sopo, Sopo. Where's my Sopo? Oh my God. I have not heard. Okay, I have to write her because I do not have her telephone number, excuse me, but for sure I will do it after the lecture. Okay, it will be uploaded. Thank you. Okay. You can go if you have another kind of, because in 10 minutes I have another lecture. Unfortunately, by schedule happened some technical problems, so excuse me that I take it shortly. Thank you once again.